We are back with another Meet the Team video for National Rehabilitation Awareness Week. This time we are shining a spotlight on respiratory therapy. We've got one of the team joining us here for a conversation, sharing about what respiratory therapy is and how it fits into rehabilitation. Let's welcome Rebecca Brower. She is a registered respiratory therapist on our team. Thank you so much for joining us and being a part of the conversation.
Thank you. So I'm a respiratory therapist here at Mary Free Bed, and I kind of go everywhere. So we work on the floors with patients, we work in IMRU and pediatrics.
And respiratory therapy is more of a newer team that we have here at the hospital. You've been at Mary Free Bed for 4 years, and you've seen how the team has grown. What's that been like being at like a young, new, growing team here within the hospital?
So at first, I kind of came on the edge of them creating their protocols and policies and kind of getting stuff together. So that was really cool to see a team go from acute care therapists coming together to now having to shift focus to a rehab setting. And then also really create the whole department, like all the rules, all the planning, all of the protocols. And then since then, I've watched them grow in their education and the type of patients they take. We now have pediatric vent patients that we'll take. So that's newer in the last few years. I know their vent adult unit was new as I was coming in, where they would take patients who had a trach and were vent dependent either at night or 24/7. And just watching them having to like wean and balance the rehab and the physiology was really cool.
And I think during COVID, we started to learn a little bit about respiratory therapy. Just for people who are watching that don't know what that is, how would you describe respiratory therapy to someone who's not in the healthcare field at all?
We basically do lungs and diaphragm up, we joke. So that could be anything from you've got asthma and you need some help when you're being pushed or exercising, to you've actually taken damage to your lungs, whether a motor vehicle accident or a disease process. And now we are helping you do the whole process of breathing. So there's very different aspects of respiratory. We've kind of hit that highlight with the disease process with COVID and helping support that, but we kind of cover anything that can happen chest up.
And I think that, there's so many different types of therapy. We've talked about physical therapy, people know occupational therapy, speech language pathology. How would you describe that respiratory therapy fits within that multidisciplinary team we have here at Mary Free Bed?
So here at Mary Free Bed, we have patients that have maybe gone through a very traumatic event, whether it is a disease or an instance of injury. So they come to rehab and maybe the process of breathing or even pulmonary hygiene, which was so easy before that, is now very difficult. So we have patients that have been laying in a bed for months, and now we're asking them to get up. We're asking them to walk hallways. We're asking them to bathe and brush their hair. And that can be really hard when your lungs are still healing. So we can either support them by keeping them on the ventilator. We'll walk the halls with them. Maybe they can come off the vent and we'll just help give them oxygen and walk them. Maybe at night we can start to put them on full support so that they're doing less work while they're breathing, burning less calories, getting more rest for another day of therapy. And then during the day, we can start to wean back some of that support and let their body kind of take control again. So that's kind of how we function here in the rehab setting versus acute.
There's this picture here I'm showing on the screen of a patient that we've shared some stories about, and I can see one of the respiratory therapists walking alongside. Can you describe what all that is there that's working with her? So Caitlin is a person we've shared stories about before. You can check that out on Mary Free Bed, but you can see her walking here along the hall. But what is that equipment that's there?
So for starters, looking at Caitlin, she has a trach in place. So those are placed either because of long-term need for a ventilator or any kind of upper airway damage. So we've put that in place. It also helps us suction out her lungs. I believe she had gotten very sick and needed some pulmonary hygiene initially. So we were able to suction her and do some of that chest physiotherapy with her. You can see a Ballard piece of plastic hanging. That's how we would suction. Miss Melinda there is holding her vent tubing. Caitlin wasn't quite strong enough to be able to master breathing and walking while she was here. So we supported her with the little box behind her. We dialed in a rate for her and some volumes. So every time she took a breath, we supported her and kind of opened up her lungs so that she didn't have to work so hard to focus on that and she could focus on walking. So And then we do have oxygen tanks on the bottom. So if she needed extra oxygen above what we would breathe in room air, we could deliver her some extra support if she did run into a little bit of trouble as she worked harder.
Now that was a little putting you on the spot there, showing you this kind of quiz about, hey, what's going on in this photo? So you did a great job on that, Rebecca. Especially reading all these articles during COVID, there was, a trach or capped or vent, and there's so many different terms. Like, can you maybe walk me through some of those common terms that people might read in an article of someone's recovery?
One of my favorite patients actually kind of went through all of these stages. We had a patient who became very sick with COVID, young patient, was previously healthy. So that was always kind of the stories that made the news were these sad cases of a very healthy individual who just really got knocked down by COVID. Required mechanical ventilation. So again, that trach was put into place. That's usually also put into place because there's less risk of infection entering the throat instead of the mouth, where secretions and saliva can drop down and cause pneumonia. He was supported with the vent. And then as he came to Mary Free Bed, we started to wean the vent. So we did use a device called a speaking valve first that can go on the trach. There is a piece of plastic that allows the patient to breathe in through it. It shuts so that air has to escape up through the nose and the mouth through the vocal cords in order to voice. It's a little bit of a stepping stone to see, is the upper airway intact? Are they going to be able to protect their airway and voice and get stronger? He did. And so then we looked at capping. So when we talk about capping, we're putting a piece of plastic just over that trach and almost pretending like it's not there. At any time, we could take the piece of plastic off and they could breathe in and out through it. We could add a vent or whatever we need. But in the meantime, we can kind of push them and see how long they can go without needing that trach. And then we can look at decannulation, which is really just a fancy word for taking the trach out and moving on with our lives.
In healthcare, we have a lot of fancy words for things, so that's always good to learn those. So, what has it been like? Why do you like working as a respiratory therapist? It's such an interesting field, and it's one of the, I think, smaller teams here at the hospital. But what brings you joy? Why do you enjoy coming to work every day for this?
When I decided to enter healthcare, I, for whatever reason, wanted to be in the thick of it with people. I did have a special needs sister, so I kind of saw the hospital side and the grieving and all of that that comes with being on the patient and family side. So I've always wanted to be in the thick of it. So I went for respiratory, and I've enjoyed all of it. We do see people at their sickest. If you're requiring a ventilator and you're requiring an airway, you don't really get much sicker than that. I do enjoy explaining to families what's going on, and just talking them through that and celebrating the overcoming of those obstacles. So when they come to rehab, I've often told families it feels like you're now in the healing stage. Acute care feels like you're in survival mode. Things are being done to you. A lot of people don't remember their stay. And then you come here and you start to heal. So then we start talking about all the tools we can do to get your independence back, get your activities of daily living back in your control, advocating for your own care, and then also inspiring families to become really hands-on and help those patients get their lives back. So I just love being a part of all of that, just kind of guiding them, talking about what's going on and what our next game plan is and how this could go, and then just seeing them become really empowered by it, whether it's caring for their patient or whether the patient is now taking back their power. So.
What we shared a little bit about some success stories, but are there any other ones that really kind of resonate with you, that you made this connection? I think rehab really, the staff become like family to these patients. Are there any other stories of, success or connection that you've had with patients during your time here?
Some of our spinal cord injury patients, again, we'll have patients come in, maybe a motor vehicle accident. So now they are completely reliant on the people around them to care for them. So I've seen patients go from being on a vent 24/7 to coming off during the day, being able to ride their wheelchair on the hallway, just get that independence where they don't have to rely on someone to push them around. They can just kind of leave. Some of them have actually come back. So we work on non-invasive ventilation at night. We'll practice that trach is not there. We'll cap it, and we'll do mask ventilation at night for our spinal cord injuries. This helps keep the lungs nice and inflated at night, so they're getting good rest, but we're also preventing pneumonias and admissions down the line. And then I've seen them come back and their trach is out and they're just doing the mask ventilation and they're working on their skills here, making friends, finding support here. So that's always kind of been nice to see that shift of lifestyle, but they're still happy and succeeding. So.
One thing I find too is in your work, and we didn't talk about this ahead of time, but I find hear a lot of this where you guys find different sleep disorders during their time with you, and you've helped them with like sleep apnea or things like that. Can you touch on that and maybe why that's kind of an unexpected like bonus from someone's recovery in rehabilitation?
We actually just talked about this as a team today. So, if you were out in the general population and needed to get worked up for sleep disordered breathing, which is usually a conversation started by a snoring spouse, that process from consultation to actually getting a CPAP device can take 6 months. Here at Mary Free Bed, we see a lot of sleep disordered breathing. Sometimes it's just been going on, and the patient ends up coming here for a completely different reason. But while they're sleeping, we're noticing they're snoring, we're witnessing apnea, we're seeing oxygen go down. Or sometimes they come to us and we know that because of their injury, they're going to have some sleep disordered breathing. So we actually get to screen them with a pulse ox. We'll watch their heart rate and their oxygen while they're sleeping. If that triggers a positive result, we call it, where their oxygen dipped to an unsafe level and we saw their heart rate coordinate with that, then we'll do a home sleep test. So we do partner with St. Mary's Sleep Lab. They will bring over the kit to us. We set it up, and then a pulmonologist will read it. Usually it's Dr. Shen, and then he'll recommend settings, and then we can start PAP here. We have the same machines we would use at home, and we can get them fitted for mass. We can get them set up. And it's nice too, because speaking from experience, my own father was a snorer. And I will tell this to patients all the time, because I'll get the men that come in that say, well, my wife told me I snore, but I think I sleep just fine and I'm okay with that. And I'll say, well, you know that undiagnosed sleep apnea, while your snoring is a nuisance to everyone around you, we do see that it affects your heart muscle. We see death at that level when the oxygen is below a safe level. The heart does start to deteriorate, and we can see heart disease come from that. We also see your increased risk of stroke. So while it's not just snoring, there are some significant safety factors with that. And with that comes irritability during the day, difficulty to wake up, moodiness. You're going to fall asleep when you're trying to sit with your family in the living room, watch TV. So sometimes just coming from that, they're like, oh, I had no idea. So we can actually shrink down that whole process, get them compliant, talk about all the benefits and get them fitted. And then they get to go home with the machine if they'll follow up with St. Mary's. So we actually take that whole process and we can get it done in a week. So that's been kind of cool to see and to actually know the whole process and what that looks like. So
Being able to just have that kind of impact in someone's life, it's probably so enjoyable. What's it like? We talked about this too, the culture here at Mary Free Bed and this team. What's it like working in this facility? I mean, we're celebrating National Rehab Week. It's an opportunity to educate about rehabilitation. Why do you like working in a rehabilitation setting?
I feel like I work at summer camp. You walk down the halls and everyone is just smiling. And it doesn't matter if it's Kent Riddle doing a little tour or if it's PT. Usually it's a hi, how are you doing? Or a good morning. It's more than just like the quick eye contact and let's stare at the floor. We see patients. There's patients I won't have seen for weeks. Maybe I saw them on admission, got them set up with a home unit. And then I'll see them in the hallways just tooling around, and I'll be like, hey, you look great. You look a lot better than last time I saw you. Like, it just feels like everybody celebrates the wins, no matter how small or how big. I love the communication here. It's much different than like the acute care setting. I can always go to PT and ask how their session went or if they need any help. Speech is a really good one too. We work closely with them because they're also using that speaking valve and that cap, and we're trying to see if they can swallow safely, if their vocal cords are getting stronger. The physicians here are great. I never feel like I have to worry about approaching them with a concern or an idea. And they are likewise will come to us if they want to know how things are going, or if they have a question of why we're not moving faster. The communication here is really great. So it feels like you're coming in to work at summer camp. You're all just here to have a good time for the day, and then we'll see you again tomorrow.
Well, that's awesome, Rebecca. I really appreciate you chatting with me today, shining the light on respiratory therapy and what it is. Here's your chance to kind of sell it a little bit too. If someone is a student, maybe they're going into healthcare and they're like, I don't know which angle or which field I want to do. Why should they decide to work here at Mary Free Bed and especially in respiratory therapy?
Well, the culture alone will kind of speak for itself. Just feeling comfortable where you're working and getting that job satisfaction is huge. But aside from that, there's a common misconception that once you have transitioned to rehab, you don't get to use your brain as much. And I would say that's probably furthest from the truth. And I'm guilty of having thought that at one point. I get to troubleshoot how a patient is going to maneuver life at home. I've had patients ask me with oxygen and post COVID, how am I going to be able to go to Arizona for the winter? Working with other teams, care management, the DMEs to figure out how can we make this happen. Just figuring out if a patient is struggling, why can't you cap? I've gone to ENT visits where I've gotten to see more of that diagnostic side. I can recognize signs in future patients of areas we're going to struggle because of that. There's also the family component of when you're talking about educating them and getting them ready for home, the way that you have to adapt your education to different levels and explain and make sure the patient knows they really need to advocate for themselves. I think I've used my brain a lot more here and a lot more freedom and just in the moment than I ever really did in acute care. So I would say that if that's what's holding you back is you feel like you're going to lose some skill set, you'd be pleasantly surprised.
Well, Rebecca, it's been so great chatting with you. I really appreciate you talking and sharing about your field. So once again, this is National Rehabilitation Awareness Week. We've been kind of doing a takeover of our social media channel, just jumping all around our system from Saginaw, Covenant Healthcare, hoping to go to Sparrow and up to Munson, really just sharing about all the different team here at Mary Free Bed across the state. We were talking with Rebecca Brower, one of the registered one of our respiratory therapists here at Mary Free Bed, and about her work on the team here. So thank again to her. Thank you all for watching and getting to know some of our team. We'll be having some more videos throughout the week. And if you are interested in volunteering at Mary Free Bed, or maybe even finding getting a job here at Mary Free Bed, go to maryfreebed.com and search for the careers tab. You can find some more information there and take those next steps. So thank you so much for watching, and we'll be back with more videos this week.